I'm Cody Williams. I'm 17 years old, and I got a spinal cord injury playing football this year for Santa Monica High School.
There was a little more than 6 minutes left in the game. Cody went in to tackle the quarterback, and the quarterback's knee hit his face mask. Cody fell immediately on the field and didn't move. And I thought that he would get up, but after some time he didn't.
You know, that Friday I'd actually been operating all day. One of the residents came up and told me about a young football player that had been injured. He was essentially quadriplegic. He was unable to move his legs whatsoever, had virtually no movement in his left arm.
A gentleman appeared and told me that it would take probably 8.5 to 9 hours, but that he would do Cody's surgery.
It was just odd. It didn't make sense. I started getting headaches, and I'm not a headache person.
He did an MRI, and then we got that phone call that you don't want to get, which is the doctor calling, telling you that, you know, the problem is more significant than they originally imagined. And when he told us that he had an arteriovenous malformation, you know, our first reaction was, well, what is that?
He said it was like a baseball with all the rubber bands. It's just like a big mass that has to be untangled and removed.
First thing that you do in a case like that is you find the best doctor you can find anywhere in the world to take care of it. And if they tell you the best doctor in the world is in Peru, then you go to Peru. We were lucky to find that the best doctor to take care of this particular problem just happened to be down the street at UCLA.
Just a few days after we had Dylan, we noticed something was wrong. He was having seizures all day long and sometimes throughout the night.
We're with you, Dylan. We're with you.
You know, here we were. We just had a baby. We were full of joy about a new baby. And the next day, we find out he's got severe epilepsy and you have to take out half his brain. It was just unbelievable. And I remember we were sitting in the NICU for 2 weeks, just stunned. Like, how did this happen? Why? And then one day, this doctor, Dr. Mather, pops his head through the curtains at NICU. I'll never forget it. And he says, don't worry, we're going to take care of this. And then he'd pop away, pop in and out. And trust me, we hung on to those words.
You feel better now? Can you tell the difference? You can't tell on that side. Good.
We brought Ernest to take care of his Parkinson's disease symptoms. And he helped us very much throughout the operation, in which we put 2 electrodes in a place called the subthalamic nucleus. Okay, Ernest, little noise. Ernest had a lot of difficulty moving, so during the tests we increased the electricity going to the brain so that he could feel that rigidity going away. Ernest, do like this for me, and the hand and the fingers, like this. And we check fluidity in the foot, in the toes.
Put your foot up. Go wiggle your toes.
His speech, we can see that was a little bit louder. He could even sing. And can you sing a song now? Go ahead.
Hallelujah. Hallelujah. My mama said that you'll be good. Hallelujah.
So we didn't disturb any of his important functions. Actually, we improved them.
Ain't nothing but a house dog. Crying all the time. It should have been Elvis Presley.
You should be Elvis Presley.
Should have been Elvis. We'll get you there.
It was a scary time, to say the least. You realize just how fragile life can be.
He looked at me and he told me I had to have this surgery, and I said, when? And he said, tomorrow. And I started crying.
And that's when we first encountered Dr. Neil Martin.
Well, Edie was very concerned about the possibility of brain surgery, as any sensible person would be. But when I explained the fact that now with the benefit of these very realistic three-dimensional reconstructions of the brain and the vascular malformation, I saw this opportunity to get to the AVM without causing injury to the brain tissue, tackling the problem directly, and then having it resolved definitively, she was relieved.
We were always confident with Dr. Martin. He exudes a certain level of confidence, so you become confident.
Cody's mom was in the emergency room at the time when he came in. And when I saw her wearing the uniform, it really made me flash back to when I was playing, when my brother was playing, and that was exactly what my mom did, and it was something that was deeply personal. Some patients, there's a natural connection between the patient and the physician. In this case, it was such a natural fit. I did this surgery the same way that I would do it if it were my son that was laying there on the operating room table.
And how lucky were we to come here to find this doctor who takes this enormous risk. This is a huge risk to operate on babies and take out half their brain.
One of the problems that we deal with children is that they don't get to us in time. They've often been seizing for months, years, before they finally come to our attention.
We found out early on that UCLA was the one place in the world that does this, and it does it so well.
Seizures are events that hijack your brain, take away that opportunity for you to interact with the world around you. Dylan's actually an example of what we'd like to see every child get, that we can offer a definitive treatment as early in development as we can so that they can grow up.
Cody's doing really well. He's really progressing every day, and his recovery's coming along steadily.
Well, it's different because he's having not any seizures anymore, so that's good. And he eats and poops and sleeps and...
Well, first I started off not even being able to sit up, and now so far I've been able to stand in parallel bars and take steps in a swimming pool. 2 weeks ago I started school. In the next 6 months I hope to be back up walking, and hopefully I could just get back to 100% like I was before I got hurt.
We are extremely grateful, as it happens when someone saves your life.
Just a total miracle compared to what he was before. You have no idea. Every day that we see him laugh, we are just so grateful, so grateful.
I feel like he was an angel sent to the hospital, because without him, I wouldn't be this far.
What would we have done if it hadn't been for UCLA? There's no way we could have gotten through it.
What we've come to learn is that this is a place where great ideas come about, and some of the thinking here and some of the technology here is just far greater than you find at any other hospital.
Making miracles is not easy. With your support, we can continue to create medical miracles like you've seen here today. Without that support, none of what we've shown you is going to be possible. On behalf of all the patients that you've seen, the patients that we've treated today, and the ones that we're going to treat tomorrow, we want to say thank you. Thank you for all you've done to create these miracles.